Welcome to today's video about early signs of lymphoma. Did you know that over 735,000 people worldwide are diagnosed with lymphoma each year? What's even more shocking is that many people don't even recognize the early signs until it's too late. Research shows that up to 80% of patients experience early warning signs, but most dismiss them as everyday issues. Fatigue, night sweats, unexplained lumps. Sound familiar? But is it something more serious? Have you noticed the strange symptoms lately? A lingering cough, sudden weight loss, or even numbness you can't explain? These could be warning signs your body's giving you. Don't panic. This video is here to help you understand the 15 early signs of lymphoma backed by medical research. And stick with me, because knowing these signs could save your life or someone you love. Ready? Let's dive in. Please note, this video is for informational purposes only and is not a replacement for professional medical advice, diagnosis, or treatment. Always consult a healthcare provider for any medical concerns. All research information shared here has been verified by researchers. You can find all references to the studies mentioned in the description below. All right, let's dive into the key early signs of lymphoma, starting with the first one, swollen lymph nodes. When your immune system detects a problem, like an infection or inflammation, lymph nodes often swell as they work to filter out harmful substances. But when they stay swollen for no clear reason and feel firm, rubbery, and painless, it raises concern for something more serious, like lymphoma. Lymph nodes are home to white blood cells that help fight infection. But in lymphoma, these white blood cells, lymphocytes, turn cancerous and multiply uncontrollably. This causes the nodes to enlarge. Unlike swelling from a common cold or sore throat, lymphoma-related swelling doesn't shrink once the infection clears because it's not caused by bacteria or viruses. It's driven by abnormal cell growth. Recent research published in the journal European Journal of Hematology, 2024, highlights that lymphoma cells often secrete proteins that alter the normal behavior of lymph nodes. These proteins can make nodes swell before any other symptoms show up, even if you feel completely fine otherwise. The study also notes that swollen nodes in the neck, armpit, or groin are often the first clue for doctors to investigate further. If you notice a lump that doesn't go away after a few weeks, or if it's growing, it's worth discussing with your doctor. Early detection matters. Recognizing this seemingly simple sign can help catch lymphoma before it spreads. Next, number 2, persistent fatigue. Feeling tired now and then is normal, but when exhaustion sticks around even after rest, it might be more than just stress or a busy schedule. Lymphoma-related fatigue can be overwhelming, affecting your entire day, making even small tasks feel impossible. Unlike regular tiredness, this fatigue is constant and unrelenting because cancer cells are using up your body's energy. This type of fatigue happens because the body's immune system is in overdrive, fighting against abnormal cells. It also releases inflammatory proteins called cytokines, which disrupt the energy balance and leave you feeling drained. What makes it different is that this fatigue doesn't improve with sleep or rest. You wake up exhausted and feel mentally and physically worn out. A research from the journal Hematologica, 2013, highlights that fatigue in lymphoma patients isn't just physical, it's also linked to psychological distress, which can worsen symptoms. The study shows that addressing fatigue early can improve outcomes, especially when paired with timely diagnosis. If you've noticed yourself feeling unusually exhausted for weeks, even without much physical effort, it's worth checking with a doctor. Early signs like this are easy to dismiss, but they're often your body's way of signaling that something isn't right. Don't ignore that voice inside telling you to slow down and take a closer look. Next, number 3, unexplained fever. When the body detects something abnormal like cancer cells, the immune system kicks into high gear to fight off the threat. This response can cause fever, even if there's no infection present. Lymphoma tricks the immune system into staying active, triggering inflammatory chemicals called cytokines. These chemicals raise your body temperature, leading to recurring fevers that seem to have no cause. It's your body's way of sounding the alarm, even though the source of the problem isn't obvious. Unlike fevers from the flu or other common illnesses, Lymphoma-related fevers often come and go without reaching very high temperatures. They tend to linger for days or weeks, especially at night. You might feel warm, flushed, or even experience chills without feeling sick in the traditional sense. A study published in the journal American Journal of Translational Research, 2022, found that fever patterns in lymphoma patients differ significantly from those in typical infections. Researchers highlighted that these low-grade fevers are often the first clue that something is wrong, especially when paired with fatigue and weight loss. If you've noticed repeated fevers with no clear cause, it's worth paying attention. Don't dismiss it as a random illness. Your body might be trying to tell you something more serious is going on. Next, number 4, unexplained weight loss. When your body starts burning calories faster than usual without any changes to your diet or exercise routine, it's worth paying attention. Lymphoma can trigger a rapid metabolic shift because cancer cells grow and divide quickly. They consume energy at an abnormal rate, leaving your body struggling to keep up. This can result in unexpected and noticeable weight loss over a short period of time, even if you're eating normally. What makes this weight loss unique in lymphoma is that it's not just about burning fat. There's also a breakdown of muscle and lean tissue because the body's inflammatory response is in overdrive. A study published in Life Sciences in 2017 highlighted how metabolic changes caused by inflammatory cytokines, particularly IL-6 and TNF-alpha, play a direct role in weight loss in lymphoma patients. These inflammatory markers accelerate muscle wasting, contributing to more than just fat loss. Unlike dieting or intentional weight loss, this type of weight drop is usually paired with other symptoms like fatigue and night sweats. It happens quickly and can feel beyond your control, making it a strong early warning sign. If you or someone you know notices unexplained weight loss, along with other unusual symptoms, it's essential to see a doctor. Next, number 5, night sweats. A sudden rush of intense heat at night, waking up drenched, can feel alarming, especially when your bedroom is cool. These night sweats aren't just an inconvenience. They can be an important clue to what's happening inside your body. In lymphoma, this happens due to your immune system reacting to cancer cells. The body tries to fight back, and this immune response throws off your internal thermostat. It leads to episodes of overheating, often during sleep, which causes the sweat. A recent study published in the European Journal of Hematology, 2024, highlights how cytokines, the chemicals your immune system releases when it's under attack, are key players here. These cytokines trigger fever-like reactions, which explains the nighttime temperature spikes. Unlike ordinary sweats, lymphoma-related night sweats come without warning and drench your clothes and sheets, leaving you feeling exhausted and chilled afterward. This isn't just your body cooling off from a warm room. It's a deeper warning sign that something may be off with your lymphatic system. If you're noticing this, along with other unusual symptoms like weight loss or swollen lymph nodes, it's time to take it seriously and consult a doctor. Recognizing this early can make a big difference. Next, number 6, itchy skin. When the immune system misfires, it releases chemicals that can irritate the skin. This reaction is often seen in people with lymphoma, even before other obvious signs appear. The itching isn't due to dry skin or an allergy. It's a deeper systemic issue caused by cancerous cells triggering the body's immune response. Researchers have found that certain cytokines, proteins released by the immune system, play a role in causing this itching sensation. These proteins are meant to help the body fight off infections, but in lymphoma, they're released in excess, leading to chronic itchiness that doesn't go away with regular treatments like creams or antihistamines. According to a study published in the American Journal of Clinical Dermatology, 2024, itching associated with lymphoma tends to be more severe at night and is often felt on the lower legs, chest, and arms. Patients sometimes mistake this symptom for a skin condition, delaying a proper diagnosis. If you're noticing persistent itching without a rash or any clear cause, it's worth paying attention. The key difference? This type of itch comes from within the body, not from external irritants. Next, number 7, shortness of breath. Breathing troubles can be more than just a sign of lung problems. When lymph nodes in the chest area become swollen due to lymphoma, they can press against the airways or lungs. This pressure makes it harder for air to move in and out of the lungs, causing that tight, uncomfortable feeling in the chest. People often describe it as feeling like they can't take a full breath or like there's a weight sitting on their chest. Interestingly, research published in the journal European Journal of Hematology in 2024 highlights that mediastinal lymph node involvement is one of the early signs of certain types of lymphoma, especially in younger patients. The swollen nodes can grow slowly, making symptoms like coughing or breathlessness easy to overlook. You might think it's just a lingering cold or allergies, but when lymphoma affects the chest, it can even push on the heart or large blood vessels, causing fluid buildup and making breathing worse over time. What's tricky is that this symptom can appear before any lumps or swollen nodes are visible. It's a hidden sign your body gives, and recognizing it early can make a big difference in diagnosis and treatment. Always listen to your body. Breathlessness isn't just a lung issue, it could be something more. Next, number 8, loss of appetite. Changes in appetite can be an early red flag for underlying health issues, including lymphoma. In this case, it's not just a general loss of interest in food, it's your body signaling that something deeper might be happening. Lymphoma affects the lymphatic system, which is responsible for fighting infections and managing immune responses. When cancerous cells begin to grow, they can disrupt your metabolism, causing the body to use energy inefficiently. As a result, your brain and digestive system may not send hunger signals the way they normally would. Research published in the British Journal of General Practice, 2019, highlighted that inflammation triggered by lymphoma plays a direct role in appetite suppression. The cancer cells release certain proteins called cytokines, which interfere with the brain's hunger control centers. This means your body may feel full even when it's not, or you might simply lose interest in meals you previously enjoyed. Additionally, swollen lymph nodes in the abdomen can put pressure on the stomach, making you feel bloated or uncomfortable after small amounts of food. This discomfort can further reduce the desire to eat. If you notice persistent appetite changes, along with other symptoms like fatigue or night sweats, it's worth getting checked by a doctor. Listening to what your body is telling you is key. Next, number 9, abdominal swelling or pain. When lymphoma develops, it often spreads to lymph nodes inside the abdomen. This can lead to swelling or a feeling of fullness, even without eating much. The swelling happens because cancerous lymph nodes grow larger and start pressing on nearby organs, like the stomach or intestines. This pressure can also cause discomfort or pain in the lower belly. Another reason for this symptom is the spleen. Lymphoma can make the spleen bigger, which also creates that bloated sensation. If the swelling gets worse, it might interfere with digestion or cause unexpected weight changes. According to a study published in Abdominal Radiology, 2023, abdominal lymphoma can sometimes be mistaken for common issues like IBS or ulcers, delaying diagnosis. The journal emphasizes that persistent abdominal bloating, especially with no clear cause, should raise concerns for possible lymphoma. This insight helps doctors catch lymphoma earlier, improving treatment outcomes. If you notice consistent bloating, cramps, or unexplained belly pain that sticks around, it's worth bringing it up with your doctor. These symptoms aren't just about digestive issues. They can be a sign your body's trying to tell you something more serious. Trust your gut, literally. Next, number 10, persistent infections. Your immune system works hard to fight off infections, but when lymphoma develops, it disrupts this defense system. The lymph nodes, which are key to filtering out harmful germs, become overrun by abnormal cells. This weakens your body's ability to fight bacteria and viruses, leaving you more vulnerable to common infections like colds, flu, or sinus issues. What makes this concerning is how these infections behave. You might notice they last longer than usual or come back repeatedly, even after treatment. That's because lymphoma affects the production of healthy white blood cells, specifically lymphocytes, which are essential for immune responses. A study published in the journal Frontiers in Immunology in 2024 highlights how patients with undiagnosed lymphoma often report frequent infections in the months before diagnosis. These aren't just minor colds. They can be stubborn infections that don't clear up easily. Researchers found that the body's altered immune response often masks the growing cancer, making early diagnosis tricky. Pay attention to your body. If you keep getting sick or your usual remedies stop working, it's worth discussing with a doctor. Persistent infections could be an early clue that something deeper, like lymphoma, needs attention. Next, number 11. Numbness or tingling. A strange tingling in your hands, feet, or even your face can catch you off guard. Many people brush it off as nothing, thinking it's a pinched nerve or poor posture. However, persistent numbness or tingling might be more serious when linked to lymphoma. Lymphoma can cause nerves to misfire due to pressure from swollen lymph nodes. These nodes can grow large enough to press on nearby nerves, especially if they're in the chest, neck, or spine. This pressure disrupts normal nerve function, causing sensations like pins and needles or numbness. In some cases, lymphoma cells even spread to the nervous system, further interfering with nerve signals. A study published in BMJ Case Reports, 2011, highlighted cases where patients with non-Hodgkin lymphoma experienced nerve issues before any other symptoms appeared. The researchers pointed out that this early nerve involvement often went undiagnosed because it mimicked more common conditions like sciatica or carpal tunnel syndrome. If you notice tingling that doesn't improve or keeps coming back, it's important to pay attention. It could be a subtle sign that something is affecting your nerves. Don't ignore what your body's telling you. Early detection of lymphoma can make a big difference. And that's it for today's video on the early signs of lymphoma. Remember, awareness is your first step toward early detection, and early detection can save lives. If this video helped you learn something new or made you more aware, do us a quick favor. Type "helpful" in the comments. It really motivates us to keep producing valuable health content like this. And if you've got questions or health topics you want us to cover, drop those in the comments too. We'd love to hear from you. Don't forget to like, subscribe, and hit the bell icon so you never miss a video that could make a difference. Thanks for watching, and we'll see you next time.